Well, it's amazing the way it's able to actually cut, because as I was saying in my talk, when you do a segmentation, you can actually see a little crevice down, all right? And all you do is you just give a little push to separate where it's not been cut towards the equator and posterior plate there, it will just give way. There are some lasers that produce a lot of bubbles, but very little cut. And we see other lasers where you actually see the lines that have been cut, but they're all stuck together. And really, they make surgery even more challenging for the surgeon when we have to deal with new situations like this. So with the Z8, amazingly, because of the low energy that's delivered, because the laser head is really just there next to the nucleus, we have very little bubble gas formation, which also makes it far easier and far for visualization and far safer, especially for the beginning surgeon who's never done laser, that he doesn't have to worry that he's going to actually have a capsule rupture or blowout because he's put in the fluid too rapidly because the gas has been trapped and the gas is distending the capsular bag. So actually it is a very, very safe laser. And being able to cut the fragments very, very well is very important, especially when we're dealing with very hard cataracts. And with the current software that is available, not just 4, 6, 8, but also 16 segments, it's really very good for handling the very, very super dense cataracts that we see a lot of in Asia here, because I don't have to think, well, I'm doing a laser. I can just think, well, this is what I'm familiar with. I'm just going to chop. And if I put my chopper anywhere, it will just find that crevice and the pieces will just fall apart. So it's really been very, very helpful in my practice.